Good afternoon. You'll get sick of me. I'm going to read for my son later on also. Good afternoon. Many thanks to all advocates for their presentations and comments. I especially want to thank Mary Schweitzer and Charmian Proskauer for highlighting concerns about young people. I want to address 2 hallmark symptoms of this illness and then highlight 5 points about the process you will use. Number 1, post-exertional collapse, unfortunately known also as post-exertional malaise. Post-exertional collapse can result from minimal physical or cognitive exertion, is unpredictable, and lasts for days or weeks. The pervasiveness of post-exertional collapse often has no correlation with the minimal exertion of the triggering event. Number 2, impairment of executive function. Impairment of executive function is evident in areas such as processing speed, reaction time, working memory, and concentration. These impairments have been reported as a significant concern both in research and in reports such as FDA's Voice of the Patient. As of today, you have just 371 days until your deadline for the clinical diagnostic criteria of this illness. Important things I think you should think about. 1, this illness may require different diagnostic criteria such as pediatric and adult, depending on the age at presentation. 2, the definitions used to select patients for studies greatly impacts the study results. Therefore, assessment of literature about this illness must include careful evaluation of the definitions used and the symptoms covered therein. I think you've heard some of this before. The clinical diagnostic criteria that you have agreed to develop will have far-reaching effects on diagnosis, health insurance, and treatment, and will likely have very important effects on school accommodations for young people with this illness. 3, clinical diagnostic criteria for this illness should include detailed assessment of symptom severity and frequency and should reliably assess post-exertional collapse and cognitive impairment. 4, the clinical diagnostic criteria must include clearly defined criteria and appropriate assessment tools. It must be as accurate as is possible at this point in time. As you develop the diagnostic criteria, think about how this criteria will best serve patients and practitioners. The outreach strategy you develop to operationalize and disseminate this criteria must provide for widespread education about this illness so that patients are appropriately diagnosed, including all those who are currently undiagnosed or misdiagnosed. 5, this afternoon is a very limited time to spend with those who know this illness best. FDA spent months poring over input to develop the voice of the patient. Your work will be most successful if you engage experts and patients throughout the process. Thank you. And now, on behalf of my son. For those who don't know, my 2 sons are patients. I'm the caregiver. Good afternoon. My life changed quite dramatically 9 years ago at age 12 when I got sick with this blasted illness. I went from being an active adolescent to being housebound. In one sense, I am one of the lucky ones. I was diagnosed within 6 months of onset. This is not usually the case, as research has shown that all too often patients are undiagnosed or misdiagnosed. That brings me to the question of the most important thing you should consider throughout the course of this study. The criteria you develop must be accurate. You must carefully consider if separate criteria are needed for onset in populations of different ages. The criteria need to include assessment of frequency and severity of symptoms. Assessment of cognitive impairment must also be included. Because physical and cognitive exertion can result in post-exertional collapse, it too must be included in the criteria and must be accurately assessed. Keep in mind that post-exertional collapse with this illness is different than in other illnesses, and our physiological response to exertion is different than that of other people with other illnesses and healthy people. I said earlier that in a sense I'm one of the lucky ones. In another sense, I'm not. Despite now being a patient of one of the best specialists, despite doing everything I can to try to get better, I haven't been able to. No treatment that I have tried has been successful. That there are no successful treatments is likely due to heterogeneity of patient population as a result of overly broad definitions. Replacing this heterogeneity with accurately diagnosed patients will help us move forward to identify successful treatments. Accurate clinical diagnostic criteria will benefit me as well as all those who are undiagnosed or misdiagnosed. Precise clinical diagnostic criteria will reduce that heterogeneity and will improve the suitability of study cohorts because those diagnosed with this illness will know if they qualify for research studies. Studies will have more appropriate subjects, and resulting study signals will be clearer, enabling assessment of treatment safety and efficacy. Until there are successful treatments, I, like many others, am stuck. I guarantee you we want to be healthy again. I leave you with this quote from Dr. Leonard Jason. In order to progress the search for biological markers and effective treatments, essential features of this illness need to be empirically identified to increase the probability that individuals included in samples have the same underlying illness. Thank you.
Please thank Matthew for us. Our next speaker is Ella Peregrine or Jay Spiro.